this medical bed for so long already prior to your surgery that you're going to be commencing and having today. That's right, yes. Nothing to worry about for the surgery though. I do, however, just need to go over an exam on you before we bring you in for that surgery. Sort of a pre-anesthetic sense exam, because we need to make sure that you're healthy so that when you go onto that table, you're in the best possible hands, but we need to make sure that your health is in the best possible way that it could be when you go into that room. Okay, so I'm going to be doing you took the words right out of my mouth, a cranial nerve exam. That's right. So, have you had one done before, possibly? You have. Okay, so you sort of know the process and the steps. Okay, I do them a little differently, but that's okay. It still is the process of the cranial nerve exam, just I have a unique set of utensils that I used in order to test those nerves. Okay, so first things first. Let's be sensible and safe and put on our gloves. Great. Yeah, I will be right back. Yeah, I'm back. Just needed to get a different set of gloves. These ones had ripped and they were in the cabinet over there. Great. So the first thing we're going to do is I want to make sure that your body is oxygenated. So I'm going to be using this nasal cannula and I'm just going to be putting it over you and I'm just going to be administering some oxygen to you. I do apologize. This hospital is near an airport, so if that's what you're hearing right now, it's temperamental. It's temporary. It's okay. So let's focus on this. So I just need you to be comfortable. I'm going to put this down and into your nostrils, just this nasal cannula here, and then we'll get on with it. So just tilt your head up for me a sec there. Great. Okay. Just gonna place that just inside your nostrils there. Okay. Okay, now let's turn on the oxygen. Just gonna turn that valve. Okay, you should feel some oxygen going into your nose. Do you feel that oxygen going into your nose right now? Great. Okay, yeah. I'm just gonna make the line go down and around so that it's not fully on your body. I need to be able to see what I'm doing here. Okay, now that you're comfortable, you're oxygenated, or you're getting oxygen, let's start this exam. So the first thing that I'm going to be doing is just having a feel around your face, just looking for any lumps and bumps, and then we'll get on to the cranial nerve portions. So I'm just going to come in here. Now, I want to make sure, are you alright with me coming in? I'm just going to be feeling around your neck and everything. Is that okay? Good. Okay, so I'm just going to be feeling around the sides of your jaw. And just coming down along your chin. And just back up. Feeling along your forehead. Great. No lumps and bumps there. I like what I'm seeing. Just going to feel down along your Adam's apple now. So just tilt your head back for me. Just feeling down. Okay, I'm just going to put my hand on your Adam's apple. Can you swallow for me? Great. Thank you. Okay, so no lumps and bumps. Let's get into this portion. So the first thing that I'm going to need to do is I'm going to be looking at your eyes today. So I'm going to be doing a series of movements. I'd just like you to follow along with them. Blink as normal as you'd like. If you feel your eyes becoming watery, we can take a little break for a second. So I'm going to be looking at the dilation of your eyes right now on your left and right eyes, okay? Okay, so just be normal, blink as you need, and then look at the light. Okay. Pupils equal and reactive. side. Just follow along, okay? You won't know where I'm starting from, but just do your best to follow along. Follow along. Keep following along. Great. Any pain or discomfort there as we're doing those eye movements? No? Great. We're going to do a little series of tests where you follow my fingers. You tell me when they get blurry or when they become in focus to you, okay? So first of all, just follow my fingers here. Now, when you're looking at my fingers, are they focused? Are they blurry? They're focused, okay. Now, as I move them away, do I become in focus? Let me know when I'm in focus. I'm in focus now. Okay, good. I like that. Your depth perception is good. I'm going to start on the outside out here. You let me know when my hands become in focus. Okay, so as I come in, let me know when they're in focus. They're in focus. You can see me moving them. Great, and I'm going to come back. Tell me when I'm in focus. I'm in focus. Great. Depth perception. No problems there on that cranial nerve exam. I do apologize. It must be a busy day at the airport. There are just a lot of planes taking off today. Let's do our best to just concentrate on each other during this cranial nerve exam. Okay, so I'm going to come back in. I'd like you to look up for me as I examine your eyes, okay? So just tilt your eyes. This is where I need you not to blink. Actually, what we can do just to help open your eyes more is I've just got some medical tape. I'm just going to tape up your eyebrows right there. Okay, that one. And just tape up this eye as well. Okay, great. Eyes are a little open now, I can see that, but that's okay. It helps me look into your eyes more. So, as you're looking up now, please. Alright, and looking up. Looking up, thank you. Looking down now. Looking down. Keep looking down. Okay, looking up. Okay, looking down. Looking down. Great. I'm not seeing any macular degeneration or anything. You must eat a lot of carrots and get your vitamin D, don't you? You do, good. My assistant is just calling me. I will be right back. I do apologize about that. Being one of the only doctors in this hospital, I get called on a lot, so I do apologize. Now, where were we? Just doing the eye exam, okay. So, now that we've done that part, I'd just like you to just let me know. I'm going to put up fingers at random. I'd like you to tell me how many fingers there are at a time. Okay, ready? And how many fingers? And how many fingers? And how many fingers? How many fingers? How many fingers? Great. No problem with your counting there on that cranial nerve. So, like what I'm seeing so far. Now I'm going to be coming into your ears now, and I'm going to be listening to your left and your right ears, doing some audible tests. You let me know if you're having any troubles hearing. Okay. Alright, so I've got a new device that I've got. It's quite a nice device. It's very simple. They are medical grade pens, but they send out, my language today, they send out audible noises that are quite nice to listen to, but they help me help you to know which ear we're out of. So you let me know which ear you're hearing it from. Which ear was that? And again. Which ear? Great. Sorry about that little frog in my throat. Now we're going to come in and do it again. Let me know if it's equal in both ears. Was that equal in both ears? It was. Great. That's excellent. I don't need to do really much more of the hearing test on that. That's more just to make sure that your ears are working. So what I'm going to do is I'm going to be doing the prick test where you let me know whether it's sharp or soft on select points of your face. I've got an item here. It's not super sharp, as you can see. It's just got a little bit of a point on it. And then I've got a Q-tip. Just your standard Q-tip. You let me know when it's sharp and when it's soft, okay? I'm not going to tell you what I'm doing. You let me know. So I'm coming in on your left cheek here. So here we go. And was that pointy or soft? Okay. And we'll do it again. And there we go. Pointy or soft. Okay, so you're doing well so far. And pointy or soft. Pointy or soft. Great. And we're going to do the right cheek now. Pointy or soft. And again. Pointy or soft. Okay, here we go again. Pointy or soft. And again. Pointy or soft. Great, you only got one wrong. I forget which one it was, but I remember that you got one wrong. All of the rest were right. Now, I'm just going to be coming along down onto your shoulders and into your arms a bit, doing the pointy and the soft as well. So you let me know. Okay, so ready, and pointy or soft, and pointy or soft, and pointy or soft. Great. Onto the other side. Pointy or soft. Pointy or soft. Pointy or soft. Great. Cranial nerves are intact. Now, I want you to just open your mouth. I'm just going to have a quick little look inside. I do apologize. I've seemed to have split my glove open. I'm just going to make my way back to the cabinet and just grab another glove. 1 second. Okay, I'm back. Sorry about that, but safety is paramount here, so I needed that new glove. Now, where was I? That's right, I was going to get you to open your mouth so I can just have a little peek inside. Okay, so just nice and wide, and go, ah, and stick that tongue out like this. Ah. Great. Good, perfect. Yes, I saw those lights as well. Those are the ones I have in the back, so I can really make sure that when I'm looking in your mouth, yes, that one there. That's so I can really see in your mouth quite well. Okay. Can you move your tongue to the left? And to the right. Tongue, top of your roof of your mouth. And can you put your tongue into the bottom? Yeah, just like that. Excellent. Wonderful. You are an A+ patient at the moment. So a couple more things I forgot to do on the eye test. I've just got my simple eye tool here. You just let me know if I become blurry when I cover one of your eyes, okay? I'm coming in on the left eye. Now, coming close. Am I blurry? Oh, I'm still not. I'm not blurry. Good. Now, the other eye. Am I blurry? No. Excellent. I love that. I'm going to be coming in. I'm going to cover both eyes, and then I'm going to remove it super quickly. You tell me if I'm blurry or not. So, covering your eyes now, and then I'm going to let go, and then you let me know if I'm blurry or not. Was I blurry? No, I was always in focus. Great. Your eyes react to light very quickly, sort of like, just like that. That's great. Now, on to some of the color tests that we have before I listen to your heart. Yeah, a very important thing to listen to, but we're just going to make our way down. So, I've got an array of colors. Very simple. You just is this? What color is this? And this. Lastly, this. Now, you tell me, how many colors do you see? Very quickly, you have to tell me, how many colors do you see? I'll let you focus. Did you get it? Yes, the answer was 5. Great. So, color test. I like what I'm seeing. I'm going to do one final test. It's just going to be on the back sides of your ears with my audible tools. Let me know if you can hear these noises from the back side of your ear when noises aren't coming in, like these planes above us today. Okay, here we go. I'm just going to come in behind your ears here. Let me know if you can hear them still, okay? Could you hear that? I'm coming just behind your ears again. You can hear that? Okay. And now I'm going to come from behind your ears forwards. You let me know when it becomes more audible as opposed to less audible, okay? All right. Now, it was more loud then. Okay, we'll try that again. Tell me when to stop. Same spot. Good. Your ears are excellent at listening. Now, how's that oxygen doing in the cannula that I gave you in your nose? It's doing good. Okay, yeah. Your surgery's in about 25 minutes, so I'm just going to do the last test here, listening to your heart. A couple breathing techniques to make sure that your lungs are okay, and then we'll have you on your way. Okay, so, I do apologize. It's a little cold. Okay, I'm just going to come in here now. I'd like you to just breathe normally. I know that when we say to breathe normally, you start to nod. So just pretend like you've won $50 million and you're spending it in your head. How's that sound? Great. Okay, so just going to listen to your heart now. Excellent. I like what I'm hearing, a steady beat. Now, I'm going to ask you to take some deep breaths in. I'm going to be listening to the upper, middle, and lower quadrant lobes of your lungs. Okay, so deep breath in for me, please. Thank you. And in. Hold it. Okay, and out. And again, in. Hold it. And out. Last one, in. Hold it. And out. Great. We're going to do the other lungs now, the other side. Deep breath in. Hold it. Out. In. Hold it. Out. Last one. In. And out. Sorry. In. Hold it. And out. Excellent. Your lungs sound great. No cackling. No whispering. It's wonderful. They're equal on both sides. I like what I'm seeing and hearing. So, with that being said, I'm going to give you the full health of Bill here before I send you off to Margaret, my assistant, where she'll just give you all the details of what the surgery will entail. When you're done the surgery, I'll be coming back to follow up with you. Maybe not right away, one of the other doctors will, but I'll be following up with you in a few weeks about this surgery. And that is right, it is a surgery. You guessed it, we did cranial nerves. It's on your brain. So the next time I see you, you'll be coming back for that post-op checkup from the surgery that we're doing inside your brain. Do you have any questions? No questions? Okay. Now, the last thing, it was a memory test. I just need to ask you a couple questions to see if your memory is intact for that last and final cranial nerve. Starting off simple. Do you remember your name? Good. you remember? Okay, good. I'm glad you remembered that. How many colors did I show you at once? Yeah, good. Alright, your memory's intact. I'll be heading off into the surgery room to prep myself now. Margaret will finish off all of the rest of the preliminary things to get done. A little bit of paperwork, some signatures, and I'll be seeing you in the surgery room. Take care. Bye-bye.